This program was produced by and first broadcast on Radio Hawke's Bay, a community access media station. Thank you to New Zealand On Air for making this type of programming possible.
Good morning everyone, this is Heiko Late from the Acupuncture On Air show in Hawke's Bay, where we interview acupuncturists from around the world. Now we're having a bit of a run at the moment because I did a series of interviews with a doctor of acupuncture in the UK, and now we're going to be talking with another doctor of acupuncture from Australia, Jeff Shearer. And as we found out in Jeff's last show, he does a lot of work in his private practice in Newcastle, in just north of Sydney, in musculo skeletal disorders, but he also treats problems to do with arthritis. So good morning, Jeff, how are you?
Oh, good, thanks, Heiko. Great to be back, mate. How are you?
No, all is good here. We're actually having amazing weather, actually. It's a bit cool in the mornings, but yeah, beautiful days. Now, I know in New Zealand with acupuncturists, you know, by default, we get a big percentage of patients coming in with injuries, and it's predominantly due to the fact that we've got the ACC, which is like the government insurance fund that treats injuries. But what's interesting is the actual ACC data shows that most patients, after recording their injury with their doctor, will first go to the physiotherapist and have a course of treatment, then usually manipulative therapists, and then if there's no change, then acupuncture, usually some months later, when a condition has become, more chronic or more serious. What's it like in Australia now? I mean, are patients coming to you as first port of call, or do they sort of come after the conditions have sort of become chronic and they've started to search for other answers?
Yeah, good question, Heiko. Generally, what we don't have an insurance scheme in Australia like the ACC, so the only insurance that's available is essentially private health insurance. We are not able to access Medicare. Mm-hmm. We're the only registered practitioner body that aren't able to access the Medicare system. And so if essentially clients are going to the doctor with an injury, generally we tend to find we're not really a first thought that the doctors will do, because the doctors can give what's called a healthcare plan, mm-hmm. Where someone might be able to go to the chiropractor for 5 sessions at a reduced rate. So it's maybe a little similar to the ACC, but not quite the same. Mm-hmm. And so we don't actually fit into that. We're not able to access that.
So by default, market forces are sort of working against you,
Yeah, absolutely. But look, I think I've certainly in my experience over the years, most of my practices have been fairly busy. At the moment, I see sort of between 60 and 70 people a week, and that really comes down to cross referrals. So I do get referrals from physios and chiropractors and osteopaths. I develop relationships with those different practitioners, and I refer to them as well, depending on what's going on with my clients. But also just general marketing, the internet. We get a lot of people come from Googling acupuncture and deciding that they're going to come and see me. So that's a large part of it, but we do get a combination of people that have just tweaked their neck or just sprained their ankle, and then we also get people that have been in chronic pain for the last 5 to 10 years, and they've tried everything under the sun, and they come to see us as a last resort.
Yeah, because I know with the term musculoskeletal problems is such a broad statement, or a broad description. But I think the statistic is that something like 60% of all people will suffer back pain at some stage in their life. So I'm presuming, like me, you'll just have a large proportion of back problems coming in. But maybe tell us a bit about these conditions with these patients, and particularly sort of how you would tackle back pain. Whether it's a chronic or acute, or is there a different strategy that you would do?
Sure. So Heiko, for me, as I think I said in the previous interview, I do a lot of palpation. So just because someone comes in and say, for instance, they've got, right-hand side neck pain, I'll check the whole back. I'll have a look at everything, because quite often you might find that there could be a gait issue, so the way in which they walk. can be a little bit off because they might have an issue with their foot. And so that can find its way all the way up into the neck. So for me, I like to look at the big picture, the whole person as a unit, rather than sort of just focusing on the symptom itself. And so through that palpation, we'll pick up a range of different tight spots through the body. Then obviously what we're wanting to do through the treatment is we're wanting to feel those change. So as we treat, we're going to go back and we're going to check all of those tight spots and make sure that by the end of the treatment, all of those have at least changed, if not gone.
Okay.
The other thing I look at when we're looking at, if it's extreme pain, generally I tend to like to treat them, probably twice a week for a couple of weeks to try and get that pain significantly reduced. And then we might start looking at some exercises to help them to be able to stabilise that issue. The problem with pain is it causes tension, then it means that we don't want to move, and sometimes that movement can be the thing that actually helps us to recover more effectively.
Yeah, because that's what I know with acupuncture, that we've got so many different aspects of it. We have dry needling, neuropuncture, motor points, electroacupuncture, cupping, moxibustion, tung and tan, and whatever. But maybe just give us a really quick example of just maybe one case of how you approach the treatment of an acute back sprain or something like that.
Yeah, okay. So an acute back sprain, so the first thing I always look at, Heiko, is how we're going to position the person on the table in such a way that they're not going to get off the table and they're going to be worse than when they got on. And what we certainly find is when people lie flat on their back, if they've got lower back pain, then it's going to be worse when they get up. So first of all, we need to consider their position. So straight out of the gates, we use hydraulic tables that we can move all sorts of different bits. We make sure that their knees are bent so that it takes that pressure out of the lower back and they can lie comfortably. The next thing that I'll look at is, again, as I say, I will palpate from the neck all the way down to the toes. I will check everything along the way and then identify the tight spots. From there, I'll select treatment points or treatment point, and then I'll apply that. Once I've applied that needle, I'll go back and check all those tight spots. If those tight spots have started to change, then most of the time these days, I will go back to that needle and provide a very, very light stimulus. So the way that I look at it is we apply pressure just to the point of resistance on that needle. So we're looking for a tight spot.
Okay.
When we find that tight spot, then we just sit there, come back, check all the points again, find that it's changed, go back to the tight spot. Sometimes you might find that tight spot has changed and all of a sudden it's loose. So then I'll just insert the needle a little bit deeper to find another tight spot. I'll basically repeat that process until I feel that there's been a significant change in that level of tension. And also the pain as well. As I'm palpating, the client lying on the table can give me feedback to tell me that, yeah, that feels different. Yep, the pain's definitely less, or the pain's gone. And so that's what I'm really looking for. Once we've done that, we'll leave that needle or needles in for a period of probably 20 to 25 minutes, and then I'll come back in and we'll discuss like further treatment and exercises, stretching and strengthening sorts of things from there.
Okay, yeah. Because I actually find that in my own private practice, and I've been in practice like it'll be 40 years next year, but
done.
I go into these cycles, which I call is the waftiness of the appointment gods, And like sometimes they just send me a whole bunch of people who've got tennis elbow, and then none, And then I'll have people come and they've got neck sprains, so they sort of come out of the woodwork somehow. But now, what about you? Are there any specific body sites that you specifically treat? Is there any sort of major condition?
Well, it's interesting, Heiko. I think I've got a similar situation, but what I tend to find is that if I haven't really treated a lot, over the years I've found that if I haven't really treated a lot of something, all of a sudden I'll get that condition and I'll have to learn how to figure it out, and then I figure it out, and then all of a sudden I get a whole bunch of them. So I do, classically, like I'm sure you would, neck pain, headaches, shoulder pain, frozen shoulder, lower back pain, obviously, sciatica. Plantar fasciitis is something that's not uncommon.
Mm-hmm.
Tennis elbow, knee pain, They're the sort of main ones, I would say.
What about necks? Do you do much with necks?
Yeah, absolutely. Yeah, neck pain, heaps, yeah.
Yeah, because I find I get quite a few neck problems, and often they're quite chronic, and I think what happens is that some of these patients have been scared off by more manual approaches, such as manipulation and mobilisation. It's not because it's but just sometimes it seems to aggravate it, and then they get too scared to have more treatment of it. And what they like about to see me is that I can treat their neck, but there's no actual needles in the neck. I don't even touch their neck half the time. So
I tend to agree. I think it's I think that sort of local needling approach has some limitations because you're already going to be protective of that area, aren't you?
Yeah. So, but I think we've still got some time. Just while we've got you here on this show, I would just like a little bit of idea about how your treatment strategies for arthritis. And I know that more people, are coming these days to seeking particular treatment for arthritis, particularly because of the problems with the, the non-steroidal anti-inflammatory drugs causing problems. So, you want to throw in a few words for that, Jeff?
Sure. So look, I'd look at arthritis as, it depends. Obviously, there's two main versions. You've got osteoarthritis, which is basically the wear and tear is greater than the repair process. And then you've got rheumatoid, which is where the immune system is essentially attacking the joint tissue. Mm-hmm. But in both cases, there's an inflammatory issue. And so it's not just about treating the sites of pain, it's about treating the systemic inflammation. Certainly for me, acupuncture is very effective at being able to bring that down. But I certainly find that you need more than just acupuncture in most cases.
And so you're talking Chinese herbs here for arthritis?
Absolutely. So I use a lot of herbs with arthritis type scenarios. But also I find Pico diet's a very big contributing factor because essentially the digestion is the birthplace of the immune response. And so if the digestion isn't functioning as well as it should or could, or we're eating foods that perhaps
causing inflammation,
then it will magnify the inflammation significantly. And I've certainly treated some very, very serious cases of autoimmune problems, Crohn's, rheumatoid arthritis, and seen some absolutely amazing changes in the levels of pain and the levels of inflammation using changes in diet approach.
Look, I think we're just about out of time, so thanks for joining us again. And for our next show, I'd actually like to discuss and talk about plantar fasciitis. And I'm sure that the audience out there will be waiting because it's a condition that I think is more common than what people think.
Yeah, absolutely.
So okay, so look, it's good. We'll get you in on that next show, and we'll talk to you again, Jeff. And have a great week, everyone, and we'll see you on the next show.
Thanks, mate. Take care.
This program was produced by and first broadcast on Radio Hawke's Bay, your community access media station. Thanks to New Zealand On Air for making this type of programming possible.